And we're live. Welcome to another edition of Beyond the Headlines. And this evening we'll be looking at COVID-19, bringing you updates. I'm pleased to present our panelists this evening. We have Dr. Candace Olusola. She has a doctorate in pharmacology. She is based in Kentucky, USA. Dr. Olusola, it's so great to have you. And we have, based in Grenada, Dr. Terrance Marryshow. He's been a medical practitioner for more than 20 or 30 years, Dr. Marryshow, since
30 years.
Since I was very small, very young, let's say, because I'm older now, much older. Dr. Marryshow has been a practicing professor. He's a Cuban-trained doctor. And we will be joined at 8:30 thereabouts by Dr. Roland Purcell. He's a medical doctor based in New York. He has a very packed schedule, but he has promised he will fit us in from 8:30. So let's get the ball rolling. Dr. Olusola, we understand you have some Grenadian roots and ties. Interestingly.
I do. My mom is from Grenada and she grew up there. So a lot of Grenadian culture has been embedded in my life living as an American kid. So really appreciate the culture and I'm very proud to be Grenadian.
And we're very proud to have one of our very own doing great work in the U.S. And whenever people like you unpack your schedule so you could fit us in, we are just so honored. And we thank you sincerely for agreeing to do this.
Thank you.
Great. So let's start with where we are. And let's start with Grenada. Dr. Marryshow, we'll start with you. There's a COVID dashboard that is issued by the Ministry of Health periodically. And we could take a look at the dashboard in terms of the number of cases. The producer will help us with that. The number of active cases, we look at the vaccination numbers, and that's where we will spring the discussion from this evening. The COVID dashboard, Grenada. I believe we have 222 cases. The producer is going to help us with those figures now. So, Doc, let's speak to those numbers. 222 confirmed cases so far?
Right, in all. And 113 imported ones. So, as you see, the majority of them have been coming from the outside. Majority of people have recovered. We have 182 recovered cases as well, and we have only had one death thus far.
Okay.
In terms of vaccinations, we have 22,454 people who have had the first dose of the vaccination, and 17,968 haven't had the second dose, which is woefully inadequate, really, and that speaks to the situation that is currently unfolding in Grenada at the present time. You see,
go ahead, Doc.
When you work hard for something in your life, you usually get it, don't you? I would say that in our situation right now, we have worked very, very hard to be in this situation that we currently find ourselves in, where in a very short space of time, we have had a dramatic increase in cases up to maybe just a few months ago, or a month ago. The situation was quite manageable, it was good. And we could have counted ourselves very, very lucky that it wasn't as bad as it could have been, considering the situation in other countries. But we rested on our laurels and we took things for granted and we created what I would consider as a perfect storm. When you consider a population that is only like 17% vaccinated, a variant like the Delta that is more transmissible and deadly than the original one, a population that takes a lot for granted and does not maintain a lot of the COVID-19 protocols and mitigation strategies that have been outlined for us by the Ministry of Health. And a population that has participated in super spreaders at Carnival time, where the government announced that there was going to be no Carnival, but the people in defiance of the law went out and partied as if it was Carnival time. And therein the crisis that we have right now, because by doing that, we have created a situation now that is becoming untenable. Whereas in the past, you were able to do some contact tracing with 1 or 2 people. Now it's dozens of people. And we are dealing with a variant that is much more transmissible, much more deadly. And the possibility for this to increase exponentially in the next couple of days and weeks is very, very real. And this is why, in the past, when I spoke about this thing, I was speaking with such passion about it, because this is what I feared, and my worst fears have come to light, because I knew the complacency with which we were dealing with this situation, in addition to the anti-vaccine trend that was building up in Grenada, people just listening only to the negatives rather than looking at what was really positive, which is that the vaccine saved lives. And I warned several months ago about the possibility of that variant taking over. Because when it did, now it means that the original vaccine, which would have been very, very effective against the original COVID-19 strain, would be less effective against the variant as it is right now. And that's why people are talking about a booster now and all of that, because the variant is so transmissible, it's so effective right now that the 2 vaccines that many people would have gotten already, not so much so in Grenada, because as far as I understand, the AstraZeneca vaccine is not required. You're not required to take a booster for that as yet. The recommendation for that has not come. But certainly for the Pfizer, which is now in our midst, we have just gotten Pfizer vaccines. You need the first one, you need the second one, and possibly down the line, you're going to need a booster. So we have created a situation here that we have nobody to blame but ourselves, because we have not listened to good advice. We have followed all of the lies and misinformation. We have followed the conspiracy theories. We have chatted on social media with all of the people who are negative, and those are the things that we continue to embrace rather than understand the science, which is when there was no vaccine, people died like crazy. In the United States, over 600,000 people died. The minute the vaccine came on stream, that number dropped dramatically. Then it started to surge again, because in many of the states, a lot of people were not vaccinated. And so we had another crisis, which was the crisis of the unvaccinated. And so we have a surge in the United States again that is due to the Delta variant, which is not responsive as the original COVID-19 virus was responsive to the vaccine. And so that trend now is coming into Grenada. And as a small country, we just do not have the resources to deal with a really serious outbreak. We are lucky so far that people are not falling down and dying from it. But God forbid if that should happen, because we do not have enough ventilators, we don't have the wherewithal and the infrastructure to really truly deal with the situation. So God help us if it really comes to that.
And so you've raised some important points about what was happening in the U.S., and that's why we want to bring in Dr. Olusola. And when after she gets going, we could take a look at the numbers across the world, which would list out the U.S. So, Dr. Olusola, what's happening in the U.S. as far as COVID-19 is concerned? Don't forget to unmute your microphone.
Thank you. So in the U.S. right now, we are experiencing a surge that's very similar to what we saw last summer. And of course, last summer we didn't have vaccines, and we still weren't sure what was going on. But now, a year from then, we have the vaccines out, and there's still a lot of vaccine hesitancy. And so we're starting to see our hospitals fill up similarly to last year. We actually just saw a report over the weekend that the state of Mississippi is completely out of ICU beds throughout the whole state. And they've been one of the states in the nation that has been struggling the most with getting vaccine access to pockets of their state, as well as vaccine hesitancy. And so it's been very disheartening the last few days, even just seeing the surge. And we've also entered into a space where, because so many states have allowed for people to go in and out of places without their masks, and basically going off of the trust system. And people were already frustrated with having to wear a mask, that we're seeing cases rise because of that, because we're really not sure who's actually vaccinated and who isn't. And there's not going to be any mandate to show that you were vaccinated over the whole United States. And that's basically a state by state or a business by business choice right now. So we're starting to see a lot of issues with the surges because of that, and we're just not sure what's going on as far as whether people are vaccinated or not. We also have kids going back to school at this time, and you have the ages that are still not able to get vaccinated going back, and there's hesitancy between parents and school systems as to whether or not they should go ahead and have kids come masked, if everyone in the school system should be vaccinated that's eligible. If you don't want to send your kid to school, you go ahead and homeschool them. What does that look like? So it's been kind of chaotic. The level of tests are going up because of going back to school as well. And so there's just a lot of continued concern throughout the nation overall about what's going on. And I do believe, though, that the approval of the Pfizer vaccine today by the FDA might help, because a lot of people were concerned about taking a vaccine that was not officially approved, but they did say that if it was, that they would go ahead and get it because they would just feel more comfortable with that official stamp from the FDA. So we're just seeing a mix of things right now, and different states are trying to contain what they can as best as they can with the resources that they have available to them.
Great, and let's segue then into that report, because you mentioned the FDA granting full approval of the Pfizer vaccine, and we do have a report that was issued today. So let's get some assistance from the producer with Roland and come back with the discussions on that.
Stop the spread of the Delta variant that so many of us are so concerned about right now?
Well, I think this is going to do three things. Number one, like we just mentioned, it's going to hopefully address some of the concerns that the vaccine hesitant have. Number two, there's going to be more mandates in place. So hopefully people,
okay, so
even
actually, if that's the wrong insert. That's part two of the insert. So there is the Pfizer approval ones, because that one speaks about what happens from here. So let's go with that one, and then we come back to the second part of the report.
The FDA has now granted full approval of the Pfizer COVID-19 vaccine, making it the first COVID vaccine to transition from emergency authorization status to full FDA approval. For more now on the FDA's approval of the Pfizer vaccine, I'd like to bring in physician at Stanford Children's Hospital Health with Dr. Alok Patel. Dr. Patel, let's talk about, first of all, what does this FDA approval actually mean for all of us right now?
Well, good morning, Kara. What this basically means is that with 6 months of safety data, now remember, emergency use authorization only requires a couple months, that the vaccine is still safe, is still effective, and now it just opens the door for more universities, businesses, corporations, even local and state governments to mandate the vaccine. And what this means is that people out there who wanted to wait and see or wanted to see more safety data got exactly what they wanted this morning. So this is all optimistic news.
So how much of a difference then, with that in mind, do you think this is going to make for people that were very hesitant about getting the vaccine? Is this a sign to them that, look, we've done the research, it's safe, get it?
Totally, Kara. So based anecdotally, with how many patients, people messaging me on Instagram, friends and family who are talking about wanting to see more safety data, this is huge for them. This is game changing. If I go just directly off numbers, we've all heard about those survey numbers coming from Kaiser saying about 3 in 10 unvaccinated Americans said they wanted to see more data. They wanted to see a full FDA approval. If we look at 3 in 10, that's 30%. 90 million eligible Americans have not yet gotten vaccinated. So that's potentially a difference of tens of millions of people. So that is big. Hopefully the other group of people who are vaccine hesitant will see this and say, okay, that is 6 months of safety data. It's still over 90% efficacious. And this is data coming in from multiple continents. This is safe. This is work. I'm going to go and get it.
So, Dr. Marryshow, just before we ran the report, Dr. Olusola was talking about the possibility to have an increased uptake. And interestingly, this approval came on the day that it was rolled out in Grenada. Now, Pfizer is available. What is your take on here on out?
Well, one of the things that the doctor just said is that possibly to deal with the vaccine hesitancy that most people have. One of the problems that a lot of people had is the fact that person by emergency or experimental use, and a lot of people were thinking that, oh, this is experimental, so I'm not going to put that into my body until they're really sure about what they're doing, so we're waiting and see. A lot of Grenadians have that attitude. We're waiting and see. Well, for those who have been vaccinated already and fully vaccinated, we are in a good position, we're in a good situation. Doesn't mean that we won't get it or can't get it, but we know for a fact that we're not going to end up getting seriously ill, we're not going to end up in hospital, and we're not going to die if we get an infection. And so, for all of those who wanted choices, and I said that on all the programs, beggars can't be choosers, because when we had only AstraZeneca, I was asking and begging people to embrace it, because that was the only hope that we had at the time to really fight this dreaded disease. Now, a lot of people wanted choices, so now they have choices. And I certainly hope now that we have the Pfizer here, that those who are on the fence and those who are hesitant and who have been hesitant for so long and wanted choices, I hope the time has come now for them to embrace that choice that they now have, and particularly as it has been approved today, fully approved, for no longer for experimental use, but for where it can be mandated. So you can embrace it now. You can't worry about the safety, because it would not be approved if it were not safe. And again, the bottom line is that the vaccine saves lives. How much more proof do we need when we see how many people died from it already and how many people were saved when it came on stream? And now that people are, those who have not taken it, those are the ones that are getting sick and ending up in hospital. Even young children now are getting it. It is infecting younger people, so that variant can also mutate into another one,
But Doc,
and the longer we take to vaccinate, the longer and more time we give more time to the vaccine to mutate and to make it stronger, so that the next time it comes, it's going to be even more virulent and more transmissible.
But Doc, some people would question you on your claim that you would not get very sick if you've been vaccinated before. But I want to come back to that, because we have seen what has happened with Reverend Jackson in the U.S., Jesse Jackson as well. But Dr. Olusola, I see you nodding, so apparently you want to come in on here on that subject. I'll let you come in with what was flowing through your brain, and then we'll go to the whole issue. Let's look at Reverend Jesse Jackson and his wife. They've been vaccinated but still got ill. But there's something that was going through your brain, you were nodding. Go ahead.
Yeah, so I think there's been a misconception that if you get vaccinated, you're automatically incapable of getting sick. That's not necessarily the purpose of getting the vaccine. The vaccine is there to help decrease spread, to help prevent you from getting as sick overall from others who are not vaccinated. And the original purpose was actually in hopes that we would reach a sense of herd immunity in our different countries and hopefully eradicate the virus. But because we never actually reached that point, and now borders and states are opening up, we've kind of past the point of being able to try to do herd immunity, and now we're at a point where we're trying to contain it. Now with the Delta variant, the issue with the Delta variant is that, one, it was not there when we were working on making these vaccines across the world, and the virus has had opportunity to mutate. And so very similarly to how I would explain it to someone who was maybe hesitant about getting their flu shot, like, why would I get the flu shot if I could still get sick from the flu? Well, having the vaccine from the flu actually gives you a better chance of being protected from whatever the flu ends up looking like by the time it gets to where you are. And so you just have a better chance of less hospitalization and even less chance of death. But it doesn't necessarily mean you wouldn't get the flu if you got vaccinated. So similarly to the COVID-19 vaccine, we are trying to decrease the amount of hospitalizations, which right now, in the cases that we're seeing, there are way more people who are unvaccinated and in ICU on ventilators and dying than those who are vaccinated and still ending up in the hospital. So the rate or the chances of one having to be hospitalized for COVID treatment or even just trying to sustain their life from COVID infection is a lot less for those who have been vaccinated.
And you mentioned people getting sick, ending up in hospitals, and earlier you alluded to the fact that your ICU units are filled in Mississippi?
They are completely full in the state of Mississippi. They just made that announcement with the Mississippi State Health Department over the weekend that they've reached max capacity in their hospitals over the entire state.
And we have a similar report. Doc, I want to come back to you on one of the points you raised, but as this has come to the fore, let's go to another report, the NASA Guardian, that was out of the Bahamas, and the situation there is similar to what Dr. Olusola has described. So I think let's segue into that and we come back and have further discussions.
Princess Margaret Hospital is on the brink of collapse, with staff having to turn away sick Family Island patients as the state-owned facility continues to operate way beyond its capacity. That's according to Accident and Emergency Department consultant Dr. Raquel Davis, who highlighted the terrible state of affairs during a tour of the hospital on Tuesday afternoon.
People are dying. Young people are dying. We have people pull up at the critical care block, not breathing.
It's a sight you would have to see to believe. Patients lined off along the walls next to each other, some crammed in one space in A&E, and some crying and groaning in pain. The situation has become nearly too hard to bear for physicians, nurses, and other staff with the mammoth task of providing health care.
We passed the breaking point. And I don't know how you could be past the breaking point, but it is to that extent. We have hospital workers who themselves have lost their loved ones to COVID. And even in that, I've lost my father to COVID. And I had to pick myself up and remain in the fight.
Our cameras were allowed in the hospital to show the severity of the situation. Posted on the walls are memorials for those members of the hospital staff who have died during the pandemic. But the state of affairs is such that even those critically ill Family Island patients are being told there is no space.
They call us from Abaco, they're calling from Andros, they're calling from Eleuthera. They have patients either symptomatic for COVID and testing positive, or they need to be investigated for COVID. I have nowhere to put them, and so I have to delay their transfer.
With COVID positive patients inside and outside the facility, the hospital is bursting at the seams.
Those are the tents that are housing all of our COVID positive patients, and there's a barricade that's actually set up so that we would keep the distance that is needed so that we who are out here would not be exposed to the COVID positive patients.
From the outside, you can hear coughing. Those patients on their hospital bed hoping to get better as they battle the COVID-19 virus.
I don't see this continuing like this. We must have a relief. Something has to happen for the whole medical team, that's doctors, nurses, support, and indeed the actual organization, because we have nowhere else. We have run out of space.
On another makeshift ward, 8 other COVID patients.
Six COVID patients can hold in the legacy unit. Unfortunately, we won't be able to go to that space, okay?
Are people over there now?
Yes, it's full.
While health officials await the results of test samples to confirm the Delta variant or any others in country, consultant physician Dr. Raquel Davis, who works in A&E, doesn't doubt Delta is here.
This Delta variant, we have no empirical evidence that is in country, but we know it's here. And this is the worst it's ever been for the whole time of the pandemic, since March of 2020.
And with the morgue over capacity, PMH has had to bring in an external cooler trailer, which is now being used to house bodies. The situation is so dire, bodies are being stored on top of each other.
Morgue is designed for the storage of about 73, 75 persons, and we're way over 150 plus persons in the morgue right now.
Officials once again making a plea for people to go out and get vaccinated. For the Guardian News Network, I'm Kyle Joaquin.
So, Dr. Marryshow, you're nodding vigorously.
You see, again, this is my worst nightmare coming true when I see something like this. Because this is real. This is real. And, all people continue to take it for granted. We continue to downplay the seriousness of this problem. And that's what really, really worries me because, we had a really great situation. And I keep harping on this because internally we did a very excellent job in terms of managing the situation. And then we could have been in a much better situation. In fact, ahead of most people where you won't have to worry about situations like this that you've just seen unfold in front of our very eyes in the Bahamas. That can happen right here in Grenada, right now, with the surge that we have just had. And that's why I worry because, you see, we are one of the first to get the vaccine in Grenada when other countries wanted it. Other countries have not even had a first dose as yet. They haven't even had a taste of that vaccine even coming into their countries. We have had the luxury of having AstraZeneca in our country for such a long time, relatively, when you consider the countries that don't have any. And if we had embraced it and used up all that we had, instead of having to give away some of what we had, we would have been in a much better situation here today where we wouldn't have to worry about a crisis like that. We would have been achieving, as the doctor just said before, herd immunity, or close to that. And, what is going on in the Bahamas compared to what we have here is something that we just have to brace ourselves and hope that it doesn't happen because we are in a situation where it can very well happen because of what happened in the last couple of weeks with all the jab activities, the carnival-like activities, the super spreaders, and the surge that we just saw recently where we have now 39 active cases. And a lot of them are the Delta variant. So, what has gone on there, I know we can't handle it. I'm certain that we can't handle it because, first of all, we do not have that infrastructure. We don't have ventilators, maybe we have ventilators for about 10 people, if so many. If they have more, well, kudos to them. But if that thing really hits here in Grenada, it won't be as the Bahamas has a better. You can see already that they have a better situation now. The facility looks so much better. You can see that they're trying their best to handle it. I don't know that we have that capacity here to handle an outbreak like that. Where are we going to put them? A hospital already can't even deal with the population that we have now for just ordinary cases. Imagine if we have 100 cases of the variant showing up at the hospital doors right now. How are we going to handle it? And see, that is why I blame our people, and that's why I've been so passionate about the need for people to get that vaccination, despite all of the hesitancy. You can't imagine the amount of arguments, the amount of discussions I've had with people, trying to convince them, listen, stop worrying about the misinformation, stop worrying about the lies and all of this conspiracy theories that you've been buying into. Because this thing is real. The vaccine is going to save your life. Please get it. Every time they ask me, Doc, what is your take on it? I said, my take on this is that I take it. I take it already. And you must take it too. And I won't advise you to take anything that I would not want to take myself. But a lot of my advice, a lot of my counseling has fallen on deaf ears. And we have a situation now that we have to deal with. I don't know how we're going to deal with it. But it is going to get more serious than it is at the present time.
It will get more serious than it is at the present time. It's on those words we hang and we take the commercial break. When we come back, we'll continue with the discussions and we will be joined by Dr. Roland Purcell. He's a medical doctor. He is based in New York, but he has his Grenadian roots. We'll be right back on Beyond the Headlines.
Are you you looking for quality herbs and herbal supplements, or are you thinking about having a complete body cleanse to jumpstart your health? Then no need to look further. Visit Nirvana Natural Health Clinic, Detox Center, and Natural Health Store. We carry a wide range of herbal products for kidney and gallstone cleansing, male sexual enhancement formulas, asthma and sinusitis, gas and bloating, acid reflux, constipation, arthritis, imbalanced hormones, female health issues, liver cleansing, weight loss, and so much more. Also available, colonic irrigation, holistic health consultations, essential oils, and diffusers. Look out for our online natural health store coming soon. Call 231-6642 for 18-7115 or 449-7753 to find out about our delivery options or to book an appointment. Visit us at Belmont St. George's, close to the Foliage, Monday to Saturday, 9 a.m. to 6 p.m. Nirvana Natural Health Clinic. Detox your way to health.
Let's get tough on breed larceny. It will destroy our economy. Larceny threatens our food security. Can hurt us locally, hurt us globally. To all the buyers, ask for license from all produce sellers. To all the people, 300 for police for them thieving fellas. To all the farmers, please don't steal produce from your brother. Then you sell it to traffickers, hotels and street vendors. Nah, man. Let's do all we can to stop breed larceny. New vigilance, new laws, and a tough judiciary. Stop Grenada's organized business crime. It's time.
To report breed larceny, call 300.
Are you looking for quality herbs and herbal supplements, or are you thinking about having a complete body cleanse to jumpstart your health? Then no need to look further. Visit Nirvana Natural Health Clinic, Detox Center, and Natural Health Store. We carry a wide range of herbal products for kidney and gallstone cleansing, male sexual enhancement formulas, asthma and sinusitis, gas and bloating, acid reflux, constipation, arthritis, imbalanced hormones, female health issues, liver cleansing, weight loss, and so much more. Also available, colonic irrigation, holistic health consultations, essential oils, and diffusers. Look out for our online natural health store coming soon. Call 231-6642 for 18-7115 or 449-7753 to find out about our delivery options or to book an appointment. Visit us at Belmont St. George's, close to the Foliage, Monday to Saturday, 9 a.m. to 6 p.m. Nirvana Natural Health Clinic. Detox your way to health.
When a loved one passes on, we all need the comfort, support, and guidance of a trusted friend. You can rely on LaCour Brothers Funeral Home. We provide a personalized professional service that exceeds all expectations. Our dedicated staff responds to your every need with the greatest detail, ensuring affordability with a variety of options. Our upgraded state-of-the-art facilities, spacious air-conditioned chapel with live internet streaming, a modern, environmentally safe crematorium, the only of its kind on island, private viewing spaces, large on-site repast center, a modern transportation fleet. Join our burial society today and make personalized arrangements for that final moment. As you prepare to enter your loved one into eternal rest, visit or call LaCour Brothers Funeral Home and select a package that brings added comfort to the entire family. LaCour Brothers Funeral Home and Burial Society, continuing a tradition of excellence.
Valley Pharmacy offers both wholesale and retail pharmaceutical and over-the-counter products. We have the most competitive and affordable prices. We are the agents for Vit Plus multivitamin for healthy everyday lifestyle and Sanatogen powder. Hills and Valley Pharmacy supplies the best quality, name brand clinical products such as Rescue Oil, Bio Oil, Neutrogena, Aveeno, and Claritin. We offer the most convenient opening hours. Our telephone numbers are 435-6904 or 6903. Remember, at Hills and Valley Pharmacy, your health is our business. We care.
Now open, Hills and Valley Medicare Center, your one-stop for medical supplies, massage therapy, physiotherapy, and an in-house physician. At Hills and Valley, your health is our business.
We support you at every stage of your life.
For business,
For your education.
For your financial freedom.
For that new ride.
Upgrade your life with the Communal. Contact us today.
Welcome back to Beyond the Headlines. This evening we're looking at the COVID-19 update. We know we have had an uptick in cases here in Grenada in the last couple of days, let's call it the last couple of weeks. This evening, our panelists are Dr. Terrance Marryshow, Grenadian medical doctor trained in Cuba. We have Dr. Candace Olusola. She is based in Kentucky in the U.S. and she has a doctorate in pharmacology and she has Grenadian roots. We are so pleased to have her join us this evening. And we'll soon have Dr. Roland Purcell. We're trying to get him logged into the system and to ensure that his audio and video is okay. And we're in the process of doing that, so we'll be joined shortly, hopefully by Dr. Roland Purcell. He's trying to get into the system. Dr. Marryshow, before we went to break, we looked at what was happening in the Bahamas and you were commenting on the state of affairs there vis-a-vis what Grenada's infrastructure looked like. Earlier though, I want to go back to a point you made earlier about the fact that there's this talk now about booster shots, which we will also have a package report on a little later. But some people will still hold out and argue with you, Doc, that, well, we've seen people like the Reverend Dr. Jesse Jackson and his wife fully vaccinated, and they have still done with COVID-19.
Well, I mean, again, the science doesn't say that you can't get it or you won't get it. And Olusola, she spoke to this a while ago. The vaccine does not eliminate the virus. It certainly reduces your chances of getting it. And if you have pre-existing conditions, and I'm sure Reverend Jackson has some underlying conditions that would make him a little bit more susceptible to something like this. But we've seen, yes, the incidence of breakthrough infections, which is that the fully vaccinated can still get infected. We know that, and that is something that has to be admitted. But we know that the number of cases who are going to end up on a ventilator, as it was during the first wave, and even now with the second wave, of those who are not vaccinated, that the vaccine is going to help you to prevent that. That is what it's all about. I mean, nothing is perfect. It's not a perfect science. The vaccine is not perfect by any stretch of the imagination. But certainly, for the majority of people who would have gotten a breakthrough case, they would not end up being so seriously ill. The majority of them are not going to end up on a ventilator. The majority of them are not going to die. Very, very, very few are going to get so seriously ill as unvaccinated, where they're going to end up dying. So we can't generalize when we see one or two exceptions and use that note to become hesitant again. Yes, you can get breakthrough infections. Yes, you can be vaccinated and still get it. But you are not going to be seriously ill in the majority of cases where you're going to end up in hospital and die. That doesn't mean that some people won't, like everything else. And then we have to take into consideration some of the underlying or pre-existing conditions that some of these people might have had that would predispose them to getting more infected. And, the viral load is going to be a little higher than other people. So, it's something that we have to look at. And yes, we know people are hesitant, but again, the bottom line is that the vaccine saves lives. Those who are unvaccinated are the ones who are more susceptible to it at this present time. And we see it again in the statistics in the United States. We see it even in our own setting right now, where a lot of the unvaccinated people are the ones that are getting the disease and have to isolate or when they end up in hospital.
I'll ask Dr. Olusola to probably take a pan, in the Caribbean we say pan-Caribbean, but this would be pan-global look at some of the numbers, and as a producer to assist us, because we do have some graphics on that. Looking at where we are worldwide. So there's a WHO dashboard which gives the global figure, and it looks at the number of people who, and there we have it. Dr. Olusola, you probably could take us through some of those numbers.
Yes, let me kind of blow this up a little bit so I can see it better. So that we're at 211 million, over 211 million global infections. Is that what that says?
Yes.
Can't see it very well.
Yeah.
And then over 4 million deaths. And so I know you can see that the graphs they're slightly trending up. And that's concerning for us globally, because I think this is actually a good graph to think about when we look at our different countries. Our countries often, or our citizens often, think about what's just going on at home. And I think we forget that we're in a global crisis. So looking at something like the over 2 million or over 20 million, 200 million that are infected. And we're seeing numbers like 4 million or plus that have already died of COVID. We have to remember that we're actually fighting this together. And so we need to remember that a virus is looking for a host. It needs a space to replicate and get stronger. And the more we can do to prevent the virus from getting smarter, quicker, the better we can to contain and get to that space that everyone's craving to get back to, where we're able to just hang out, do what we want to do, travel where we want to go, and be with our loved ones without worry that we're going to infect someone or cause a whole country to shut down their borders. And so things like that, the push for vaccines is really, we're not trying to suffocate anyone in how they believe they should take care of their body, but it's coming from a place of a public health mindset that we're taking over our hospitals in a way that they cannot handle for too long. It's going to affect the infrastructure of our healthcare systems, not just in America, not just in Grenada, but globally, to where people who actually need a hospital bed for other things, they won't have the room to provide it for them. So this is affecting people beyond COVID. It's affecting people who have chronic diseases like diabetes, high blood pressure, high cholesterol, lung diseases, liver diseases, cancer. We have to think about people whose immune system is already naturally suppressed or low. So when we say to get vaccinated, we're not just protecting ourselves, but we're also trying to protect those whose systems are already vulnerable to catching anything and being in a state where if they were to get it, they're more likely to pass away. And we don't want to cause that crisis in our own homes, let alone everywhere else in the world. So it's very important to recognize that, we look at the ratio of how many people are dead to how many people are infected. And we come up with the percentage and go, oh, that doesn't seem like a lot. But in reality, we don't want to lose a lot of people. We don't want people to get sick. We don't want people to pass away. We don't want to have our children who are vulnerable regardless because they don't even have access to a vaccine if they wanted one, or if their parents wanted them to get one, and they end up in hospitals. And we're already seeing babies in ICUs and NICU being hospitalized because they're affected by COVID. And when we think of our vulnerable population, as far as our babies are even concerned, this is a global crisis. So I highly encourage that everyone starts to think about this on a global scale. If you're one of those people that are still unsure about whether or not they should get the vaccine, please speak to your provider. Please stay away from the conspiracy theories and the videos that are flying around still all over the internet. Speak Speak to a provider that you know and you trust. Speak to a public health professional. Speak to your pharmacist, speak to your nurses, speak to people who are in the hospital helping COVID-19 patients and are in the ICUs and are overwhelmed, very much like we saw in our clip earlier. Just ask the people that you know and make sure that you're reading credible information from the scientists that are working around the clock to not only figure this out, but protect themselves and us. Know that we're doing our best in healthcare. We're doing everything we can to get the information and to collect it, to do the research. And so trust us when we say we want everyone to be safe. We want everyone to be protected. And to say that we have 4+ million across the world that have died in the hands of COVID, that's 4 million, way too many. So please do what you can. Wear a mask if you can. If you don't have any lung conditions, please go ahead and put on a mask. And social distance, keep your space, be mindful of other people's bubble of where they are comfortable with you being in their space. Continue to wash your hands and do what you can for your community. Think beyond yourself and think about the world. We're here together. We're trying to do it together. We're fighting this together. Please join us in trying to do your best so we can all go back to doing the things that we love to do without this fear of trying to figure out what the virus is going to do and how it's going to affect us and our loved ones.
Well said. So Dr. Marryshow, when he sees patients or people come to him seeking advice as to what they should do, there's one experience. In pharmacology, what is your experience like? Do people come with questions, concerns, and ask you, well, is there any meds I can take? What are ways around this? What kind of queries do you get, Dr. Olusola?
I get all sorts of questions. I get questions about, please tell me the truth. Do you really think that the vaccine is safe, or are you scared of the vaccine? And I gladly tell them I got the vaccine. My whole family got vaccinated. My loved ones have gotten vaccinated. And those that didn't have, some of them have unfortunately already passed away. And so it's important to, if you're not comfortable speaking to me, speak to someone you trust that is in healthcare and, get those questions answered. I do get questions about whether or not you should take things like vitamin D or have vitamin C or get euthanasia or take NAC. And a lot of things have been studied throughout the pandemic as far as just trying to keep your immune system up. Whatever you're doing to keep your immune system healthy, do that, whether it's exercising, eating a holistic diet, getting enough vitamin D, getting enough sleep. Those things overall protect your immune system from any type of disease out there. So that's always great. There hasn't quite been specific like over-the-counter or herbals that have yet been proven to really help or contain COVID, but we do get questions about what to take. So I do often provide just general ways to keep yourself healthy when taking supplements and vitamins and exercising and eating well.
All right, so they've heard it from all sides and all angles this evening. We did tell you that we were trying to get Dr. Purcell logged in. There seems to be a slight technical issue that we need to sort out. So let's just take a quick commercial break. We really want Dr. Purcell to join in on the conversation. Dr. Marryshow, he should have been on the program with us some months ago, and he had an emergency surgery, so he couldn't make it on, and we really want to have him on this evening. So we'll take a quick commercial break. We try to sort it out, get him into the room, and he will join the conversation. This is Beyond the Headlines. COVID-19, the new trends we're following.
What does it take to be an amazing woman? Lots of me time. Amazing women are classy, fancy, and a little sassy. It's the drink for me. Cheers! Sometimes you've got to show them who's boss. Alpha male? Nah, alpha females are more amazing. Cheers to securing the bag. We make time for ourselves, for work, friends, and we certainly make time for passion. We're simply amazing. Amazing cream liqueur for the amazing woman in you.
Get Rubigas. Get cooking. Rubigas, clean, safe, and reliable LPG is the perfect solution for your commercial and everyday needs. For cooking at home or barbecuing, choose Rubigas LPG cylinders. Available in a variety of sizes from 20 to 100 pound cylinders. Rubigas LPG, clean, safe, reliable. Are you cooking with Rubigas?
Get Rubis, get going.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
Welcome back to Beyond the Headlines. This evening we're looking at COVID-19, the new trends. There have been several developments in the last couple of weeks, including today with the FDA approving the COVID-19 vaccine Pfizer. Our panelists this evening, Dr. Terrance Marryshow, Dr. Olusola, Dr. Candace Olusola out of Kentucky in the United States, and Dr. Roland Purcell, who we're still trying to get logged into the system. I believe I hear from the producer that he's on. Yeah, Dr. Purcell, we see you. Good night. Welcome. Dr. Purcell, are you hearing us? All right, so apparently Dr. Purcell isn't hearing us yet, but we'll get that sorted out hopefully so we can hear from him. Let's go to the second part of that report. The FDA grants full approval of Pfizer 2, and we will have some discussions with the panelists when we come back.
All right, so then what do you think? How can this help stop the spread of the Delta variant that so many of us are so concerned about right now?
Well, I think this is going to do three things. Number one, like we just mentioned, it's going to hopefully address some of the concerns that the vaccine hesitant have. Number two, there's going to be more mandates in place. So hopefully people, even if they weren't thinking about it before or they were hesitant, will stop now to ask their doctors, ask a trusted source. This is mandated at my work. Do I need to get this? And number three, Kira, is that a full FDA approval allows for some of those off-label uses, such as boosters. And so these are three different approaches here. But remember, there's still a large population who is not getting vaccinated for other reasons. So this does not mean that we have to step the foot off the gas pedal in terms of targeted messaging to certain groups and addressing misinformation. That still has to happen.
All right, so you just mentioned the booster shots. What does this mean for that?
Well, this means that, the Pfizer booster shot, so that's the third shot for Pfizer, can likely get approval now because of the full FDA approval for Pfizer. Moderna is still going to need a little bit more time. That's supposed to get full FDA approval in a couple of weeks. Johnson & Johnson, we haven't seen yet. So this could potentially start happening as of September 20th, just kind of based on the rough estimate about when the boosters can go for those people who got the Pfizer shot. And polls are also showing that a large percentage of Americans who have been vaccinated are in favor of a booster shot. But we've been talking about this since the first day the vaccines rolled out. If we just are focusing on people who are fully vaccinated getting a booster shot, and we're not totally addressing equity, we're not out of this pandemic yet. So while this is good news, it's not a complete end in sight.
So, Dr. Marryshow, I'm certain you'll pick up on that. Dr. Purcell, can you hear us? Dr. Purcell? All right, so apparently he isn't hearing us yet, but we have him on. Right, so Dr. Marryshow, tell us about the booster shots, because we just thought
a welcome development, because it's certainly going to deal with vaccine hesitancy among the American population in particular, who, for the most part, have been resistant getting vaccinated. And so we're happy that this is taking place at this time. But one thing we have to bear in mind is that the vaccine is not as effective against this variant as it was against the original COVID-19 strain. So we always have to remember that as well. And the possibility of getting a booster down the line strengthens that claim because it is not as effective. Now, just an additional point, with the question that you just asked, Dr. Olusola, we have to also remember that the rich countries are holding that vaccine. And they're holding it also with the possibility of having to give booster shots. Now, a lot of the poor countries or the poorer countries are not privy to that vaccine at this time. In China and India, maybe about 3% of the population is infected. And yes, in the richer countries that are holding it, they might eliminate it in their countries. But remember that the vaccine is very violent in the poorer countries. And so the time that it gives, again, that vaccine to mutate, when you think that you might be safe against the Delta, remember that there are others that are coming on stream in other countries at this time. And because, of the travel between countries and, people going back to their countries, back and forth, the possibility, remember the Delta, again, it didn't originate in the United States. And it's all over the United States now. So part of the onus on the developed countries, particularly the wealthier countries in the world, is not only to develop the vaccine and approve the vaccine, but to find that vaccine into the arms of the millions of people in the third world and poorer countries who today are being deprived of it because they don't have it. They don't have the means to procure it, and they don't have the means to produce them, and the wealth, and so to buy them from the countries that are producing them. Now, the United States has a humanitarian effort of, I think President Biden announced some 500 million doses to be going out to all. I think we have been privileged to get a little bit of that. I think it's from that same initiative to get the Pfizer vaccine here today. But remember, there are a lot of countries who have not even had a little dose of that yet. And the longer we take to control this pandemic globally, as the doctor was saying before, remember it's a global pandemic. It's not something about the United States and Grenada alone. It's all over the world, and we have to control it all over the world before it becomes, something that is unmanageable. If we continue the way that we're going. So we have to get it into the third world as well and the poorer countries.
Don't you think probably that we're there already? And Dr. Olusola, looking at this whole issue of booster shots, are people, is that a new concern for people or an additional concern that they thought, I got my 2 shots and I was done with that, but now you're telling me about the booster shot? What's the thinking like in the U.S. as far as booster shots are concerned?
Well, we're very split on this across the U.S. We have people who have been wanting a booster shot since they got their second shot. There's people who have been very confused about why they would need a booster if they already got their vaccine, which actually it has increased hesitancy with some people. So we're trying to manage that. And I think it's very similar to how we would explain other shots that people get, where they might have to get boosters, whether it's every year, every few years, and that every vaccine has its own dosing schedule. But right now, we're in such an innovative time with creating this new vaccine that we're actually testing it to see when the effects are most likely to start wearing off where that booster would be needed. this is going to be very crucial for the future of knowing when we would need the booster. Then in the future, we can go ahead and put it in our country's, national, like our version of the FDA in every country, where they can say, okay, we have a schedule. Now we can go ahead and let people know for future that this would be the schedule for when people get this vaccine. But we're still trying to make that make sense to the general public. So it's a very confusing time. And we're seeing that depending on how states are presenting the booster. I think there's also a confusion with the difference between whether someone's getting an additional shot versus getting a booster. These are actually two very different concepts, which adds a level of confusion. But just to kind of simplify it, for those who maybe got 2 vaccines and they're needing an additional vaccine, those are the people that we consider immunocompromised. So to get an additional vaccine, that's basically saying that we're needing 3 shots to get them to the baseline that those whose immune systems are not as low are already at. So they're kind of under, and 2 is not enough for them. So they actually need 3 to be like everyone else. A booster is for those that don't have those suppressed immune systems, but the effects of the original antibodies are starting to wear off. So to give a boost to keep it up, then they get their booster. So there is a difference depending on your health condition and what is deemed to be a severe immune or moderate to severe immunosuppressed condition, that whether or not you're actually getting your additional shot to be like everyone else, or if you're getting a booster to stay above what those 2 initial shots gave you. So it's very important to also check to see whether you're eligible for needing the additional shot based on your health conditions or needing a booster. But overall, we're still trying to weed through the confusion about why we would need a booster, what the significance of that, how long does the booster last us? That's still in the process of being figured out and distributed appropriately to people across the U.S.
And what you have done there, Dr. Olusola, is exactly what people have been making appeals for that communication of those issues, because people would hear about boosters and then be like, okay, well, I'm wary of this thing, but you have just explained a very crucial point. And Doc, you were making the point in our previous program about the whole issue of how we communicate the message. But let me just see if Dr. Purcell can hear us at this time. Doc, can you hear us now? Dr. Purcell, you could hear us? He was speaking with the producer just now, but unfortunately okay, so he has some challenges on his side. We're not certain we're going to be able to get it sorted out. But to those of you listening on radio, following us on social media, and those of you watching on television, in case you want to ask some questions of the panelists, now is your time to do so. The number you can call is 440-1252. 440-1252. Dr. Marryshow, in the Grenadian context, I think Dr. Olusola did an excellent job at explaining the booster shots. But I remember as a child, or when I had my children, you did the vaccination route, and then you had to take them in for a booster after probably 6 months, 7 months. Can you help elucidate that point for us in the Grenadian context?
Well, I'm sure Grenada has one of the most comprehensive vaccination programs anyway. And that's why I'm so bewildered by the response that Grenadians have to this particular vaccine, because if there's one place I can tell you that has a good primary health system that focuses on vaccines, where you can get it from any or most of the health centers in the country, is Grenada. And we have been vaccinated all through, whether it was from MMR, the measles, mumps, and rubella, whether it is polio, whether it is tetanus. And all of these require, at some point or another, a booster shot. Tetanus, for example, every 10 years you have to have a booster just to make sure that you're safe, you know? And it is something that we do without even thinking about it. You know, we know that we have to do it, and we do it. We don't have that vaccine hesitancy when it comes to, you know, the normal ones that we've gotten all through our lives, you know, the DPT, the diphtheria, pertussis, and tetanus. We do those as a matter of routine without questioning them. And so it boggles the mind that, you know, among the present generations that, you know, are more privy to information. There's so much information out there. You know, you have Google, you have the internet, you have social media, all of these different platforms where you can get information, and good information.
Okay.
Yet we tend to just focus more on the negatives rather than the positive. But boosters are, I think, you know, of the day is something that we do all the time with our children, and we continue to do that.
All right, we have a caller who's been patient, and I believe we have everything sorted out with Dr. Purcell. Dr. Purcell, if you can hear us, can you just give me the thumbs up? Yay! You can hear,
Yay!
Finally, yay! Dr. Purcell, we come to you, but we have somebody who's been holding on the phone for a while. Caller, good evening and welcome.
Good night to you, Miss Odette, and good night to all the personnel on the station. I think that is a very sad day for Grenada, and I think all and sundry must be blamed, because I saw and heard people actually telling one another that we must play carnival, they can't stop the carnival, they can't stop the mass. And I knew that something would have come out of that, because I was very, very worried when I see authorities allow people matters like what they call it, carnival-like activities. We should have never encouraged those things. And there are persons, and I'm saying that openly now, there are persons that using that as a political paint. There are persons that using that as a political paint, and we're not realizing it in Grenada. We're using it as a political aspiration, and it is damaging Grenada. What a sign, what a pity for us.
Okay, thank you so much for that contribution. So we are finally joined by Dr. Roland Purcell. He is a medical doctor. He's practicing in New York, but he is somebody with his Grenadian roots that he's very proud of. Dr. Purcell, it is great to have you with us this evening.
Thank you very much. I apologize for my tardiness and lateness and my technical ignorance. I kind of struggled. It was a very simple problem. The microphone wasn't turned on, and that's why I was having all of this difficulty. Someone turned the microphone off. But anyhow, I'm here.
God is good, God is gracious, and God is kind. And I don't think you have technical ignorance at all. Just know that my former boss used to call me a techno peasant. So welcome to the club.
Thank you. Thank you.
Hey, Roland, how you doing, man?
Good, Terry. How you doing?
Good, man. It's good to see you.
Remember those days in GBSS?
Of course I do.
All right.
So, Dr. Olusola, you see when them Grenadian roots set across the, underneath the ground, you see what happens, right?
We went to school together.
Yes.
I love this conversation.
So, Doc, we want to come to you, but the calls are coming quickly. Let's just take another call, and then we'll hear from you. Caller, good evening.
It's good afternoon. I just want to find out, right? I know every year, August usually be a year of like a lot of flu and influenza. I have observed for the last 2 years that I haven't heard anything about influenza nor the flu virus. All I hear is about COVID, so I'm wondering what is happening. Also, in Trinidad, right, they spoke about between March 2020 and March 2021, 185 persons died from COVID. After they rolled out the vaccine from March 2021 to August 28, 1,084 persons died from COVID. So it's like I'm kind of concerned, because if within a whole year, 185 persons died, and as the vaccine started to roll out, 1,044 persons died, well, what happened? It leaves a lot of questions in my mind. In addition to that, I can see around 7 persons that I knew take the vaccine and they die from complications. I don't hear that on the radio stations at all. In addition, also
7 persons where?
No, I would not give details.
In Grenada or out of Grenada?
In Grenada. Also, it is said that when people is vaccinated, that they will not get severely sick. But I want to find out, is there sufficient data to tell us completely, listen, we have data to prove that when persons take the vaccine, they will not have severe complications. There's no data available, and if so, I'd like to know. Thank you very much. Good night.
Thank you so much. Dr. Marryshow, I think I'm parking that one in your lap.
You see, again, the science shows that, yes, you can get a breakthrough infection even if you have the vaccination. Now, we don't do studies here. I can't verify the information that the caller is just given, so I don't know about that. But I know for a fact that if we extrapolate from the experience of other countries, we know that you are more unlikely to get sick and die when you are vaccinated than when you are unvaccinated. You are more likely to die from the virus itself, not from the vaccine or complications of the vaccine. You know, all of these are conspiracy theories, and a lot of it. You know, the fact that the caller doesn't want to share that information shows that, you know, she's not even sure about what's going on. You see, here we are open. If you have information, share it, you know, so that we can know exactly what is going on. Just come in and just throw that outside there as if, you know, it's a golden truth, you know, and you can't question that. It's something that I can't support that. You know, I have to know that these are facts that can be verified, and then we can talk about it. But if you can't verify it and you're just throwing it out that, you know about 8 people. I don't know about 8 people. I've never heard about 8 people being, dying from complications from the vaccine. I don't know about that. I've never heard about any cases like that. So where the caller has got no information from, I really don't know. But I know people grab onto those negatives and use it as a tool now to be unvaccinated or to encourage people not to get vaccinated. And that is one of the problems that I have with that kind of information, you know.
Okay, Doc.
Worldwide, the trend is that people who are vaccinated tend not to get severely ill. That's the trend. If you get the virus itself, we've seen how many people have died worldwide. We put up the statistics on the screen a while ago. Over 4 million people have died from the vaccine. I mean, from the virus, not from the vaccine. So, I don't know.
All right. We have a caller on the line who will ask to be patient because we had some challenges getting Dr. Purcell in. Dr. Roland Purcell, it is great to welcome you once more to Beyond the Headlines. And we'll jump right in and ask you, just to let you know that Dr. Olusola, she's based in Kentucky in the U.S. We know that right away you saw your very good schoolmate there in Grenada. So just to put context to that, tell us what's happening in New York and what would you like to say to Grenada?
Some of the challenges that you are experiencing in Grenada is similar to the ones that we are experiencing here in New York. I would say that the central challenge that's facing us right now in terms of controlling the pandemic, in controlling transmission of the infection, is the issue of vaccine hesitancy. That, of course, is exacerbated by the propaganda offensive that's taking place on social media. It is not an easy thing to contain because of the society that we live in. We live in a democratic society. And so, since we live in a democratic society, people are allowed to exercise their free will and their choices. Now, in some societies, that choice does not exist. You either take the vaccine or you're not able to enter a public building. You're not able to go to your workplace. You're not able to use public transportation. So there are coercive strategies to force people to take the vaccine. It can't work, and it doesn't work in all society. I mean, just yesterday, I was listening to the Prime Minister of Barbados, Mia Mottley, and she clearly stated that both she and her cabinet didn't support mandating COVID vaccination. And she felt inclined to pursue a strategy based upon persuasion. A difficult option, but probably a reasonable one in the context of our society. I don't know that we are in a place where we can mandate vaccination either in Grenada or Barbados or anywhere in the Caribbean. You can probably selectively mandate it, like, for example, you can probably request that healthcare workers be vaccinated, or in certain circumstances where the risk of exposure and the risk of transmission is high, you may be able to put policies in place so that certain people who are at risk are vaccinated. But the issue still remains, how do you address the issue of vaccine hesitancy? And I'm saying that first, we should acknowledge people's refusal to have the vaccine or to take the vaccine. We cannot solve the problem by getting involved in the condemnation of that attitude or being disrespectful of that attitude, because that's not going to resolve the problem. I think it has to start with an acknowledgement of that individual's position, even when it doesn't appear to be rational and even when it doesn't appear to be making sense. Having done so, then I think your next step would be to provide data. For example, the data that we have on our hands right now shows very clearly that in the vaccinated population compared to the non-vaccinated population, the percent of people who get sick from the infection is extremely low and probably less than 1%. And if you compare that to the unvaccinated population, the percentage who get it and get sick is a lot higher. That is very compelling data. The other issue is if folks don't want to take vaccination, then they have to wear the mask. They have to be told that they should wear a mask. So if you don't want to vaccinate, then you have to wear the mask. And that's the only two ways that we have of controlling this: wearing the mask and vaccination, or both. Okay. So
Dr.
I would end by saying that the challenge still is addressing vaccine hesitancy, and we really haven't solved that problem. Difficult, because I think solving it in Grenada is probably not the same as trying to solve it in New York or solving it in Mississippi. Or the southern states are very similar to the Caribbean. There's a certain parallel in attitudes in the southern states. You know, one of my sons is in Mississippi doing residency, and what he says to me is very similar to what I hear from Grenada and what I hear from the rest of the Caribbean.
Okay.
A little bit different in New York because a lot more people have accepted vaccination in New York, but certainly you see that parallel in St. Vincent, in Grenada, in the southern states of the United States, and in other countries. And the question is, what really explains that similarity in attitude, even for cultures that apparently are disparate? I mean, the culture in Grenada and St. Vincent, Dominica and St. Lucia although similar, is somewhat very different from the culture in the United States, in the southern states, but yet you see a similar attitude. Now, is it misinformation? Is it disinformation? Is it the consequences of social media? I think those are the questions that we have to ask ourselves.
Good. And we'll ask ourselves those questions. Let's see if our caller has been patient enough to wait for us to get Dr. Purcell on the discussion. Caller, I hope you're still there.
Yes, I'm there.
We're getting close to wrap-up time, so can you make your contribution about 1 minute and no longer?
Before I start, what I have to say, I think I'll be taking more than a minute. Nevertheless, I have listened to from this morning before, listen again tonight. And I think the people in health are creating more confusion in the minds of people. And I could improve that. I heard tonight that the vaccine is not that effective. When a person in health could come out to say that, what do you expect the listeners to do? I mean, people out there are not damn fools, excuse the language. I think that in order to solve this problem, people should be told, citizens should be told all over the world, make sure you eat healthy. And as a result of that, this would help to boost the immune system. We have the fruits, we have this and all the other things. And as a result of that, I think if that is done, maybe COVID would not have been with us as it is at the moment. And as a result of that, I would say I believe in saying it as it is. You people in health, go do your homework again. Thank you.
Thank you so much, caller. Let me just make it abundantly clear that we do not tolerate any of our callers trying to be unkind and disrespectful of our panelists. They are very busy people. They take time out of busy schedules. We saw Dr. Purcell scrambling to get on. We had some issues. Dr. Olusola, she had multiple things to do today. Dr. Marryshow was telling me that I'm tired, but he still decided. So let me just say, caller, we thank you for your contribution, but please do not ever try to be disrespectful to our panelists. We don't tolerate that at any time. Dr. Olusola, we had Dr. Purcell talking about disparity, but yet there were comparatives, and I saw you nodding. The southern states and the Caribbean nations seem to have certain things in common. What's going on here?
It's a really great question. So I'm located in a southern state. I'm in the state of Kentucky, and it is very parallel to what we're seeing in a lot of the Caribbean islands right now. And I think a lot of it has to do with there's a lot of faith-based ideologies out there right now, and a lot of our conspiracy theories are actually faith-based, and that's been actually very detrimental when it comes to the beliefs of whether something is safe or not, or allowed to be in their body. And that has been something we've, much like Dr. Purcell said, that we're trying to figure out a means to explain it in such a way that we're not only respecting people's beliefs when it comes to their faith or even their politics, but that we're providing them the appropriate information to make it make sense in the context of the culture that they're living in. So to discuss the vaccine with someone here in Kentucky is a very different conversation than probably a person in New York, as Dr. Purcell is in. So this is something I actually deal with regularly with patients that I speak to daily, where you have people in rural communities. They're already in low socioeconomic areas. They don't have, there's low healthcare access. There's a difficulty with transportation to get where they need to go. There's an overall misunderstanding of how even medicine works. And so a lot of the health disparities that we face regularly have only been amplified and exposed more with the vaccine, and that the politics plus the faith compound some of those challenges that we have to think through and process through working on how we explain those things. I actually also think a lot of our concerns with some of the hesitancy in getting vaccinated is also just on how, at least in my country, in the United States, how everything was presented from the beginning, as it wasn't explained very well what was going on. And so it just seemed like this shutdown was waving across the world and people are going, what is that? What is going on? No one's really saying anything. There's nothing really consistent. And so I actually empathize with the last caller that we had in this sense of things don't seem to make sense. I'm not really sure. There's a lot of confusion between who is speaking, what they're saying. I hear that every single day with my patients. So I actually understand that concern that even healthcare does not seem to be on the same page with the scientists and with the public health workers. And I think the people are looking for a united message from those who say they are the professionals. And unfortunately, we're not getting that. And so it's very hard for citizens to say, well, then who do I trust? How do I know? Is there something that we're missing or that they're not saying to us? We did drop the ball overall, I truly believe, in how we presented the information, even as far back as last year. If we had tackled this from the beginning and had, groups like the WHO and different world organizations and different global leaders, healthcare professionals from different concentrations come together to kind of explain, this is what a pandemic is. This is what we're going through. This virus is called coronavirus. We have coronaviruses out there, but this one's different from what we've seen before, and kind of walk people through what's going on. So that way they had a sense of security versus a sense of they're trying to hide something from us. I think that is actually a greater pandemic than what we've been dealing with the actual coronavirus itself. So I think we have to also empathize with where people are coming from. Where are they in their health literacy? How much do they understand about health in general? And what information are they getting channeled to them based on where their faith-based communities are, what their community talks about and their community beliefs, how they feel about natural medicine versus allopathic medicine, or just in general, how healthcare is set up and whether they already have that trust with the healthcare systems in their countries. So it is a very difficult conversation. And I think looking at it from a public health perspective, as well as a healthcare perspective, you can empathize with the citizens. And that just leaves us with more responsibility to work together as professionals in public health and healthcare to try to ease the minds of the citizens so they can trust us better.
Roger that. And all we say is that you can make that point, but you can be very respectful in the way you make your point. We have another call on the line. Caller, good evening.
Good night, Miss Campbell.
Good night.
I have two questions.
Sure.
What do you mean about shot, and if it's possible to take it? So thank you very much.
Sorry, sir. Sorry. What did you say?
What's the meaning of booster shot?
Oh, booster shots.
Oh, booster shots. You are sorry of my pronunciation.
Booster shots, and whether people should take it.
Possible to take it. So thank you very much.
Thank you so much for that question. Let me ask Dr. Purcell if he could weigh in on this. Dr. Marryshow and Dr. Olusola had spoken about booster shots, but Dr. Purcell, it's your opportunity to get in on it right now.
Yes. The purpose of a booster shot is as follows. When somebody is vaccinated, the body produces what's called antibodies. And what antibodies are is a protein substance that exists in the blood. And that protein substance then fights the virus. Once the body comes into contact with the virus, it fights the virus. Now, in doing so, it can do that effectively over a period of time. But what happens is that with the passage of time, there is waning of the antibody levels. The antibody levels tends to fall. And for that reason, you reach a certain level where your body no longer has sufficient antibodies to protect you against an infection. And recently, the CDC and other agencies recommended one that people who are immunocompromised, meaning that people who are immunocompromised, they should take that vaccine because they don't have enough antibodies. People above a certain age should also consider taking the vaccine because the antibody levels may not be sufficient to protect them against an infection. So that's the reason for the booster shot. And it's not only for the COVID infection. If you've been given a vaccination to protect you against hepatitis B, if your antibody levels are not sufficient and it falls below a certain level, then the recommendation is that you be given a booster shot.
So, Doc, you find out by doing...
the recommendation is that you be given.
Doc, I have a question. So, is it that you take a blood test or something to determine, does that help determine whether you need a booster shot or...
If you want to get very scientific, you can take that route. I suppose that would be the most scientific way to determine whether or not a person has sufficient antibodies to protect them against the COVID virus infection.
Okay.
But I think that probably then incurs another cost on the healthcare system. So rather than take that approach, the agencies, CDC and other agencies have issued guidelines for, say, people who have had transplantation, solid organ transplantation, or people who are immunocompromised, like maybe people, diabetics, end-stage renal disease, and many other people in that category should be, and people of a certain age should be given to take it. And I certainly intend to take mine. I'm not going to shy away from it because I think it's a sensible thing to do. I am exposed every day.
Okay.
And I hope you do yours too, Terry.
Oh, I've done mine a long time ago.
Your booster shot, Dr. Marryshow, your booster shot.
Around me. My mom was 86 years old, my father, and everybody around me have gotten theirs.
All right. We have a caller on the line. Caller, good evening, and thanks for joining us.
Good evening, Mrs. Odette, and your panelists. I must compliment them for the excellent work that they're doing. Dr. Marryshow, hats off to you and to Dr. Purcell, and also the young doctor herself. I know this is very trying time for us, but a lot of people don't realize that vaccination has been with us for a while. And to me, I didn't see it as an issue in terms of being fully vaccinated as far as the COVID goes. But are we going to be getting the Cuban developed vaccine in Grenada to complement the other three that we would have already received? That's for Doc. I also want to say to Doc that I've been in the company of persons who seems not wanting to take the vaccine, but it has come home. In fact, one of those individuals is now self-isolating because his immediate family member was in touch with someone else. So I'm saying to us as Grenadians, even if we are hesitant to take the vaccine, it will still come home because we are still in touch with every other person in the street. So like it or not, it is safe. It is better to be safe than sorry. And I am appalled, disappointed, and vexed because of what is unfolding among us. Even before the carnival scenario, I had seen persons on the buses just casually not wearing a mask, and bus drivers not having in their possession the spray to sanitize. So it is very sad to see that the rooster has come home. Thank you ever so much.
Thank you kindly. Doc, he said those were specifically for you, Dr. Marryshow.
Well, with respect to the Cuban vaccine, I don't think we'll be seeing that in our medium for quite some time, because right now the Cubans are concentrating on vaccinating their own population, which is about 12 million people. Well, or less, because we're not talking about children, but they're developing it for children as well. Now, they are not as privileged as we are to receive multiple vaccines, in other countries where you have, choices. And because they're a blockaded country, they have had to develop their own vaccine. In fact, they have about 5 different vaccines in development as we speak. And some have just been approved for emergency use as well. So their priorities are on their population, and it'll be a while before it reaches here. I know Grenadians have a lot of faith in the Cuban vaccine, and a lot of them have been asking for it as well. But I think we have to go with what we have. In fact, we have choices now. Before we only had AstraZeneca. Now we have choices. We have AstraZeneca, we have Pfizer. And how much more do we want? We are a small population, and we are not a rich population. We are at the mercy of the people who have all of the wealth, and we're grateful that we are able to get some here when other countries can't even get any. So be grateful for what we have, and let us use what we have and make the most of it. We have not done so. Always remember that we have not done so. We've had to give away some of the first set of vaccines that we got. Now, the water caller said that everybody's to blame. I don't think in this case you can blame the government too much, because internally they've done a really good job in keeping us safe. And they've procured the vaccine to the point where it is available to us, and we are the ones who have not embraced it. We have not embraced it. Now, a lot of the activities that took place at the carnival time were illegal activities. Now, the police force is just not equipped to handle thousands of people who have broken the law. They're just not equipped for that. And you can't blame the police for that. You can't blame the authorities, because they declared that there should be no illegal activities, there should be no carnival type of activities. But lo and behold, people just decided, we don't care. They say God is a Grenadian, and we could go out and do whatever we want, and without any kind of consequences. We are seeing the consequences today. It would not have been so bad if a large part of the population were vaccinated. If that were the case and they went out there and partied as they did, we could understand that. But we can't understand, in the face of not vaccinating, in the face of a variant that is coming into the country from people who are coming in, that you go outside there without vaccinations and you just partying like crazy, as if there are no consequences for your actions.
Yeah.
And because of that, we are seeing that the consequences of that right now. We can't do anything. We can't do things with impunity. Today we are seeing a surge that we could have avoided had we embraced the vaccine, or taking all of the mitigation measures that have been outlined to us, and people know what they are: the masking, the social distancing, the sanitizing, all of that. If we were doing all of that, we could then excuse some of the activities in a kind of a way, although they were illegal. But we cannot excuse it, and we cannot blame the authorities when the ones who are responsible are we ourselves.
Okay, and we're getting ready to put a wrap on the discussions this evening, but we have a caller on the line. Caller, good evening.
Good evening, Miss Campbell, and how are you?
Doing very well, thanks.
How are you? How are you?
Doing very well, thank you.
Yeah, well, I must first congratulate you on your very interesting program, which are taking a lot here, and I must tell Dr. Marryshow, he hit the nail on the head, along with Dr. Purcell. Dr. Purcell, how are you?
I'm good.
How are you, Dr. Purcell?
Yeah, I'm good. How are you doing?
Yeah, well, I enjoyed the program, and one thing I have to say that the quarantine, they should make it a bit longer, especially when they say about 48 hours there. That's not enough. They should make it a little longer.
Okay.
And Miss Campbell, keep on the good program. And Dr. Purcell?
Yes.
And the lady below there.
Her name is Dr. Olusola. Thank you so much.
Afro head. Keep on the good program.
Thanks so much for the contribution. Dr. Olusola, we know that it might be a little tongue twister to get it. Dr. Olusola. Dr. Purcell, there's this discussion in the Grenadian populace now. The government has put in regulations that if you're fully vaccinated and you come into the country, the quarantine period is 48 hours. It was longer prior to this. And people are thinking the government should revert to a longer quarantine period. What's your take on that?
you know, one of the things about making decisions is risk reward. That's the basis for the decision analysis science, risk reward. So, if you are vaccinated, you are much less likely to transmit the disease and to get sick. However, you can still get that COVID vaccine. And some people have been reporting that if you're unfortunate to be exposed to the Delta virus, then the viral count in the nasal passages seems to be higher than the other variants of the COVID virus, thus making the Delta virus, the Delta variant, very, very infectious and very transmissible. So that policy does have an Achilles heel, because if you say 48 hours, the presumption, the inherent presumption here is that you have very little risk of getting the infection and transmitting that infection. In fact, even vaccinated people can get the virus and can transmit the virus. They don't get sick, but they can get it and they can transmit it. So that's the Achilles heel in that policy. And so I understand why the caller would say, yeah, it probably should be more than 48 hours. 48 hours. But, you know, there's an upside and a downside to most decisions that we make.
All right. Did you say we have a call on the line, producer? Okay. Right. So as we get ready to put a wrap on the discussion this evening, Dr. Purcell, because you joined us late, we want to get you to jump back in again in your interactions with Grenadians in the New York area who come to your office. What's the feedback? People are scared. People are still grieving from having lost loved ones. How are people moving on? What progress are you seeing, if any?
Well, you ask a very important question, because one of my patients, and she happened to have been Grenadian, her name is Noreen Peters. She's from up the western side of the island. And she worked at Brookdale Hospital, and I remember very well, very vividly, just before she fell ill, she communicated to me, and she said, you know, please take care of yourself. Maybe less than 2 weeks afterwards, she got sick, was hospitalized, and subsequently died and was buried in June. So for me, that was a very personal experience with getting COVID, and that eliminated any kind of hesitancy that I had. I remember that I got the vaccine in December 2020 because it was pretty clear to me that that was the only protection that we had against the virus. Now, in trying to make an assessment of what the attitude is, it's a mixture. Some people have taken it willingly, without any hesitation, because they are unequivocally convinced that to take the vaccine means to take an unnecessary risk. There are others who have questions about the vaccine, whether it's safe. And for that reason, some of them have chosen not to take it. But I would say that more people have taken it than have not taken it. One of the strange things that I have observed, though, is that many healthcare workers in New York area have not taken the vaccine. And it's a bit of a disturbing fact, but that's what it is. Yeah. So, I made that to make the point that even, quote unquote, folks who should know better, who are educated, enlightened, still have this attitude that you find difficult to explain. So I don't think you should really get too heavy-handed with a peasant who's living in maybe Guava or St. David's or, you know, in the rural parts of Grenada, who may have reluctance in taking the vaccine, because even in areas here with people who are very enlightened, should know better, should understand what it means to get COVID and to die from COVID. You still see that hesitation in them. So we still have a long road to travel.
Yeah. We have a question here from someone. Dr. Olusola, in your practice, I don't know what the advice is, and then we probably ask Dr. Marryshow to weigh in. Can heart patients get the vaccine and others with underlying health issues such as diabetes and obesity? My heart and lungs were compromised last October. That's why I'm hesitant. Dr. Olusola, what the advice is in those situations?
Absolutely. If you have cardiovascular conditions, you're actually highly encouraged to get the vaccine because you're at higher risk of complications without it. Now, I can understand if you did have something concerning your lungs before, especially if it was like a pneumonia, you don't want to go through that again. I would actually encourage you get the vaccine unless your doctor has for some reason said you shouldn't get it or you should wait for something specific. I know some providers were actually suggesting that for some people when we were first rolling out the vaccine, depending on what their health conditions are. But now that we've been in it for a while, if you've had issues with your heart or your lungs already and you're concerned about getting sick specifically, I would actually encourage you to get the vaccine, but please always talk to your doctor first, especially if you're one who might be listed as someone who is immunocompromised. You might have other things going on that need to be assessed and addressed when you get any kind of medication or vaccine. That's really important. But overall, if you've had any kind of issues cardiovascularly or even with your lungs, with your pulmonary system, taking the vaccine is probably actually a better protection for you than to not take it.
And Dr. Purcell, if somebody comes to you with that kind of question, your response is in sync with Dr. Olusola's?
Oh, yes, because, again, I go back to this issue of risk-reward. The benefit clearly outweigh the perceived risk. And I think whenever we make that, we have to make a decision and we're looking at what the benefits are versus what the perceived or likely risks are. When those benefits clearly outweigh the risk, you're making a good decision. What's strange about all of this is that the very people who display near incomprehensible vaccine hesitancy, you look at them and you would see them make decisions and do things where the risks are way beyond the benefits, but yet they do it. And I think they do it because they're not stopping to clearly assess and evaluate that particular decision that they are making. And if they do so, the attitude would change. And the guideline is, what are the benefits, what are the risks?
So it's a risk-benefit analysis. We were hoping to come quickly to a closure, but understand that there's a caller who really wants to get in. Caller, good evening.
Good night, how are you?
I'm well, thanks.
Yeah, I'm trying to find out a question about if somebody has asthma, if they could take the vaccine.
All right. Dr. Marryshow, you want to take that as we get ready to close it out?
Yes, again, I just want to echo the sentiments just expressed by Dr. Olusola and Dr. Purcell. Patients who are severely immunocompromised or moderately immunocompromised, the immune systems, do not respond as well. These are the people who should be taking that vaccine because their systems don't respond as well as the people who are not immunocompromised. So, yes, if you have asthma, if you have diabetes, if you have heart problems, more reason to take the vaccine because if you do get the virus without having the vaccine, your system is not going to respond as robustly as if the person who is not who has had the vaccine or who is not immunocompromised would respond. So if you are immunocompromised, your immune system is weak because you have a pre-existing condition, more reason to take the vaccine.
All right.
So that's not it. You take the vaccine.
just a couple notes on some of the points that came up earlier. One person spoke about the boosters, and one person is saying, even when you get a nail joke, you take a tetanus toxoid shot or a booster. And when issue of how the authorities should have dealt with the crowds, the person pointed out the police were pelted with stones and bottles in Poetry. And for the faith-based people, I tell them that God provides. He provides scientists to develop medicines and doctors to administer. So good notes to put a wrap on tonight's discussion. Let me ask Dr. Marryshow for closing comments, and we go around the room and we lock it off for this evening. Doc?
Again, as I've always done, I encourage those who have not gotten that vaccine to go get it. We don't have choices. You want the choices, you got choices. You can't ask for more. You have AstraZeneca, you have Pfizer. What more do you want? The Cuban one is not going to be here for a while, so don't bother with that one. Now, we've seen the trend. A month ago, we had maybe about 4 cases. After the spreaders, after the Taliban-like activities over the last 2 weeks, we now have some 39 active cases in the country. A lot of them are the variant. This situation can get very serious. And maybe this is what we wanted, so that we could understand the gravity of the situation. And I'm sorry it has to come to that, so that we could really, understand what is confronting us. So we run and get that vaccine now. If you have been hesitant, I think the science has proven, and the evidence that we have today is that it is serious. It can get worse. Go outside and know the choices that we have and get your vaccination immediately. Get it.
All right.
So that in a couple of months we can again look back now and at least reach that level of herd immunity, or reach that level of vaccination where we can start opening up the country fully so that everybody can benefit from that.
Right. Dr. Purcell, your closing thoughts this evening?
Yeah, I want to take off from where Terry's last sentence, which is the concept of herd immunity. I think that's one of the goals that we have to strive for. We should strive to get maybe 70% of the population vaccinated. There will always be a percentage of intransigent and insurmountable vaccine hesitancy. But I think you could reduce that to the point where you achieve that goal of herd immunity, which is about, depending on which epidemiology data you look at, it's about 70%. And that's what we should probably be striving for in a place like Grenada. So that our strategy now should be, in the context of Grenada, what forms the basis of the vaccine hesitancy? Is it something to do with a religious conviction? Is it something to do with what is disseminated on Facebook, on Instagram, on Twitter, and on all the other social media platforms? Is that the misinformation and disinformation? Is that the cause for that? Is it not understanding how vaccine technology works? Because there are many people who really don't have a clear understanding of the vaccine technology and how it works. And they think somehow that if you take the vaccine, you may get transformed into a man. Or if you take the vaccine, you may become impotent or sterile. Or if you take the vaccine, it somehow alters your DNA. So that some time has to be taken to try to identify the basis and precise cause of this vaccine hesitancy, and to explain to people, listen, the vaccine doesn't interfere with your DNA. The vaccine doesn't get into the nucleus of your cell where all your important information is stored. It's outside, and it's mRNA technology, which has been established for a long time, and it's safe. So I think the strategy has to be focusing on the specific causes of vaccine hesitancy and striving to achieve that herd immunity. Because you're never going to get everyone in Grenada wanting to take the vaccine, but try to reduce the number.
Okay. And Dr. Olusola, the final words belong to you.
I echo what what both of our doctors are saying here, that of course we're not going to get everyone to get the vaccine regardless of where you're located, but we do encourage that you consider doing things that help protect not only yourself but everyone else around you. So if you've gotten vaccinated or are still looking to get vaccinated, again, please talk to your providers, talk to your pharmacist, and find out how to get the vaccine and or the additional shot or the booster. If you're still concerned about the vaccine, look at other things that have been provided to protect yourself and other people regarding wearing a mask, social distancing, washing your hands. It is very challenging to process what's going on because what we're dealing with is an invisible substance. We can't see it, we can't touch it, we can see it present itself in different ways, and that is very confusing, as well as all the information that we've seen out there that may or may not be accurate, and it's spreading like wildfire through Facebook, through social media, through WhatsApp. So I just encourage that you speak to the providers that you know and you trust and have those true conversations with them. Speak with those that you know have gotten vaccinated. Ask them how they felt getting it. Ask them what their symptoms were if they got it. Ask them how they're feeling now that they've gotten it and it's been months since they got it. Ask your questions. It's okay to have questions. We're in healthcare, we're scientists, but we don't know everything. And we use all the professional wisdom and knowledge that we have from our schooling and our training, from having studied the patterns of vaccines, we know how they work. But we're still learning because this is a new virus and we're growing as well. And so trust us when we say that we're looking for the best information for you. We're looking for the best information for our loved ones. We are concerned that people are getting sick. We're concerned that this is spreading, and we want to do what we can to help everyone else. So do anything that you can to help all of us get through this together, including doing daily things that help with your overall immune system, like eating holistically, fruits and vegetables, eating your natural grains, not eating as many processed foods, getting enough vitamin D, having a strong community to help you process through these things that you can talk through your concerns and fears with. It's okay to do that, and it's important to have that, but also trust us in the health system, in the public health sector, that we are doing our best for you as well. So we hope that if you have questions, that you're comfortable asking them, because when you ask, you can find the answers that you're actually looking for, and we have the opportunity to provide those answers for you.
Thank you very much. And gentlemen and lady, just in case you wondered whether your time here was worth it, I have a note from someone who says, very important information. I think your panelists have me convinced. That's one person who was sitting on the fence, so thumbs up. You did very well this evening, if by no other measuring stick. Let me say thank you to all of our panelists. We have somebody closing out. Excellent contributions from the doctors. Glad to see Dr. Purcell on. Until we face the hesitancy head on, the progress will be delayed and slow. And just to, Dr. Purcell, I see the hand going up.
Yes, I first, let me congratulate you for having this symposium. Something tells me that maybe you ought to do this on a more regular basis. Now, I don't know whether it's a monthly or bi-weekly, or have a COVID night every 2 weeks or something of that nature where people can call in. And also that you democratize the process of sharing information and help to enhance people's understanding and enlightenment, so that they don't think of the whole vaccination as entering a black hole, some mystery, but rather that it is something that's amenable to basic scientific logic, risks and benefits. You're going to be okay. You're not going, man wouldn't turn into woman, and woman wouldn't turn into man, and you're not going to get sterile, you're not going to get impotent, you're going to have your babies, you're going to have your children, you're going to be fine. But I think what you're doing probably is the way to do it.
Thank you so much, Doc. And Dr. Marryshow will attest to the fact that, we've done some of these, but listening to how some of these issues have been fleshed out this evening, I think a lot of miles have been covered, and I just have this deep seventh sense. We go past the sixth sense, they say the sixth sense tells you. I just get this seventh sense that we have crossed some hurdles and some people have a clear understanding. There were some things I didn't understand, which I got to understand this evening. So we owe you a debt of gratitude. Grenada owes you a debt of gratitude. Dr. Marryshow, keep fighting the good fight. Dr. Purcell, thank you for representing Grenadians in New York. If we ask about a doctor, everybody say, Dr. Purcell, that's where we go. So Dr. Purcell, Dr. Olusola, it is just amazing with technology. We find people like you, we dig you out of holes. We didn't think that, we had this bright Grenadian woman, intelligent Grenadian woman sitting there in Kentucky, young woman at that. So we tip our hats in your direction, and I want to thank the person who put you in touch with us. They shall remain nameless. Grenada is getting a little touchy, so we learn to keep some information under wraps. But to that person who knows who he or she is, I just owe you a debt of gratitude and probably something on a piece of paper, but we'll see how that works out. To all of you who have taken the time to listen, to look this evening, we hope it was a learning experience for you, and we thank you for viewing. Until next Monday, I'm Odette Campbell. Just to let you know that next Monday is going to be a special night. We'll be doing a back to school special, and there's going to be a special element to it that you won't want to miss. So please tune in again next week. And we'll have to have a symposium like this apparently ever so often, maybe every month or every 6 weeks, as has been recommended. Points noted. Thank you so much, and we'll see you again another time.